In Nigeria, about 1.5 million people suffer from arthritis. Arthritis is an inflammatory joint disorder which affects the joint tissues and other connecting tissues, causing joint pain and stiffness.
Yeah, arthritis is basically inflammation of joints, which can be very painful, it can be swollen, it can be red, it can reduce movement in the joints, and it can be any part of the body actually, from the upper limbs, from upper limbs to lower limbs, the spine. It can be anywhere from young children to adults to older people. It's usually when people mention arthritis, they refer to maybe just an elderly.
There are over 100 types of arthritis, but the most common types are osteoarthritis and rheumatoid arthritis.
We have different types. We have arthritis, what we call osteoarthritis, which is common in what we call the weight-bearing joints, usually the hip, knees, sometimes also the shoulder. And then we have the reactive ones or the systemic ones. We call that rheumatoid arthritis, and that usually it's a form of arthritis that happens when the body's immune system begins to fight against the joints. And
the main symptoms of arthritis are joint pain and stiffness, which typically worsen with age.
Well, symptoms of arthritis include pain, include what we call crepitus. That is when you move your joint, you hear a sound while moving your joint. Then another symptom is what we call difficulty, what I can call difficulty in moving the joint, or pain while moving your joint.
Medical experts say physiotherapy is an important part of arthritis treatment. Staying physically active is essential for managing the condition.
As physiotherapists, our management majorly is based on exercise. Majorly we encourage you to move the joint as much as possible. Then with sometimes, depending on the severity of the pain that you have or the severity of the arthritis, we can use what we call either cryotherapy, that is using ice to bring down the pain, or we can use heat also to bring down the pain.
Because of the pain, especially when it is acute, at the onset when the pain is so much, at the early stage, the patient may not want to cooperate. But with physiotherapy, what we say, our slogan is actually no pain, no gain. So while the pain is on, we want to keep the joint mobile.
Addressing healthcare gap will ensure positive treatment outcomes. Medical experts say raising awareness about the condition, as well as enlightening the public about its management, will go a long way in improving the health and quality of life of patients. Bukola Taylor Cole, LTV News.